Happy Friday, everybody.
Hi.
Dr. Aimee Ostick here with Health and Healing Direct Primary Care, and I have a special guest today, my mother-in-law, Mary Agnes Ostick, DMP. She's the Assistant Medical Director at the Student Health Center at Villanova University in Philadelphia. And thank you for being here.
I love being here. I love your videos every Friday.
And we're going to talk a lot about what I've been getting a lot of questions from my parents and my patients a lot is college health and what to look out for in the fall, if and hopefully when you will be sending your teens back to school, what your university should be doing when it comes to COVID-19 and the precautions they should be taking. We're here on week 14 in LA County of quarantine, of the pandemic. Every week we've been doing some information regarding COVID-19, be it virology, population health, epidemiology, and I think this is a very critical feature to know about how colleges, and everybody's very different in terms of their resources, how they are approaching this pandemic. It's a very unique situation for them.
It is. I will first say that everyone who works in college health absolutely loves it when our students are on campus. The energy that they bring is just so vibrant and alive. So we are working extremely hard, all the colleges across the United States, to get everybody back on campus, but to get them back safely and wisely. So every single day since that second week in March, all colleges have been working together to try to figure out what's the best plan for them. So there are a couple things that we need to think about. First of all, bringing people back in a community where you live on campus, and some campuses are larger than others. Getting them back into dormitory situations where it would be safe. That's one issue to take care of. And most colleges are working towards that. They're not any tripling in these rooms and making it very safe for roommates to be together. Dining halls will have very maybe not that lingering at the table forever, but it might be more grab and go kind of food services. And then social distancing in the classroom. So I think that you will not see, we want everybody back, but it's going to look different this year. Until we get that vaccine, it's really going to look different, and we need to be safe and we need to be smart. But the big campus halls where you have 250 people sitting in a science 101, I think they will not be on campus this year. Classrooms will have to have 6-foot distancing. We know that when you're sitting in a classroom 2 desks away from each other, you're not really at risk, right? But we're going to make that happen by putting things on the floor and making sure that the classrooms are safe.
Okay, good. What about I've been telling a lot of my parents to look out for contact tracing, and what does that mean, contact tracing? What should colleges be doing to get those implemented?
I think that we need to understand what these words mean. First of all, coming back to campus, everyone should come with their mask, their thermometer, like their little COVID kit, right? And then and be aware of the signs and symptoms of COVID, which look very much like colds, sinus symptoms, and know where your student health center is and know that telephone number and be able to call it and go on the website of your college, especially new freshmen. You want to familiarize yourself with your college health center. What is the staff there? What time is it open? Is it open just Monday through Friday? Are there weekend hours or night hours? You want to know that, and then how to get in touch with them, right? And so here's what the scenario will look like. So suppose everybody comes back to campus and someone feels sick. I can tell you what we will be doing at Villanova. Students will call the Student Health Center where they will get a telemedicine evaluation by a nurse practitioner who will call them and talk with them and then decide this is somebody that needs to come into the health center to be tested. And we'll have the variety of testing that needs to be done for COVID. And while that is happening, if you're suspicious of somebody that's got COVID, you don't want them going back to the dormitory. So most colleges have set aside isolation beds so you can hold somebody for a while there, and then quarantine beds. 2 different scenarios here. So the student that comes and tests positive for COVID, they will be one of two things. Either if they're close enough to go home to their hometown, they'll go home for the 10 days that they need to isolate and be given the instructions on how to isolate and stay away from others in their household. If they can't, they will get a bed with us here at Villanova, and they will stay for 10 days and they will be monitored. And when they're fever-free for 72 hours without Advil and Tylenol, then they're free to go back. And of course, continue social distancing and doing all the right things. Now, the person who they are close to, like their roommate, their significant others, their really small, close set of friends, if they've been in their company for more than 15 minutes at a distance less than 6 feet, the student who's positive will give us that information so that we can contact their close contacts, their close friends. We will not disclose who it is that they were in contact with. That's confidentiality. But we are going to call them and say, look, you've been exposed to COVID. We need to evaluate you and ask you some questions about whether you've had any signs or symptoms, determine whether they need to be tested, and then put them in quarantine for 14 days. A little bit different.
Yeah.
Because there's 14 days that they may end up
developing symptoms.
So we have set aside a number of beds on the campus that will be quarantine beds. They will be called every single day to report their temperature and their symptoms or lack of symptoms. And after 14 days, they will have an evaluation and then be told they can go back onto campus, back into their regular community.
Okay. Or the isolation beds are for the positive patients.
Isolation for positive, quarantine for the close contacts.
For the close contacts.
That's
so you'll have to be hiring a lot of personnel to be doing the contact tracing, having a good system, either electronic health record or good, form documents that you'll have to be monitoring.
Yes, already done. We have that in place. So we're ready for that piece.
What about testing? So testing, what types of testing will colleges have available to them?
So that is actually at this point, and each state is different, but the American College Health Association just a week ago came out with a white paper stating what we should do. So testing, we mean not screening. Screening is when you walk into the room, everybody's going to get that temperature on their forehead, and they're going to have to make sure that they don't have symptoms. That's screening. That will be done everywhere. Testing is doing a nasal swab or doing a finger stick or doing some type of swab to determine whether they have the virus, which is called the antigen test, or the antibody test. At this point, neither of those mass testing has been recommended by the American College Health Center at this present time. Do they think maybe there are pockets of people that need to be tested? Maybe. Like if you have if the athletes go back to performing and traveling out of state, they will have to be tested before they go into another state. I'm
More
sure.
serial chest testing for them.
And if you have nursing students and medical students on your campus, their clinical sites may require that they have testing. So with the resources that we have today, those groups are going to need those tests. But at this point, that whole thing about mass testing is still not a solid recommendation.
For all the kids on campus everywhere. So right now, if you are suspected, you get probably a PCR swab.
Absolutely. There will be testing available for every student that has any type of the symptoms, the 9 symptoms that they talk about: fever, cough, loss of taste or smell, body aches, fatigue. These sound like all common cold symptoms, right? So our threshold for testing people is going to be very low.
For sure.
And we want to know. And the contact tracing that we are doing in conjunction, the health centers and your health department, your county health department will also know it. But on our campus, we will know from our tracing if there are hot pockets of dorms or teams or sororities and fraternities. We need to know this.
That'll
we need
be
to
great.
collect that data, and it needs to be in real time, up to the minute data. So we are ready to do that.
That's awesome. That's the only way to really contain and smartly control if there is starting to be a spread, a little hot pocket, is to know, in real time. I think as a parent, I would feel comfortable sending my kid to college if I had that information. So that's kind of what I would recommend parents out there looking for, is all those details that Dr. Ostick mentioned, which is contact tracing protocols, testing, if they have enough testing, who's going to be testing, and the resources that they're going to allocate to isolation or quarantine beds.
And what will the expectation be if my student tests positive or if they need to be quarantined?
Right. So expectation if they test positive, will they have to go home?
Right.
Or do you have a resource?
Or do you have a resource? A lot of schools are putting aside dormitories
Yeah.
that they're designating their COVID quarantine or COVID isolation dormitories.
Yeah. Awesome. That's awesome. I think that's great. I'm hoping that the colleges get support from the local health centers and
Yes.
health departments, and they can, follow protocol as best they can, and that kids can, continue with their educations, because it's very important.
We want them back on
Yeah.
campus. We want them safely. They need to self-report,
Mm-hmm.
take care of themselves, eat well, sleep well.
Yeah.
Being back, they're going to be so happy to be back
Yeah.
in college with each other.
Right.
But they need to really take care of themselves.
Take care of themselves, take care of each other, and they're gonna, right, exactly, it will look differently. There'll be some real maturity that will need to happen in terms of, like you said, self-reporting, being responsible.
Right. And you know what else?
Mhm.
When the flu shot is available, everybody needs to get a flu
Every
shot.
single person.
We don't know what it'll look like if you get COVID and the flu at the same time.
No.
I don't want to know.
No, I don't want to
I
know.
don't want to know. I would,
Yeah.
because I've seen some really sick flu kids, right?
Yeah,
So you don't want to get that. So please get your flu shot the minute it's available.
absolutely. Hopefully September.
Yeah.
Thank you, Dr. Mary Agnes Ostick.
And thank you, Dr. Aimee Ostick, for having me. We love being
Yes,
here. Thank
it's
you.
really fun. Dr. Mary Agnes Ostick, she's Assistant Director at Villanova Health Student Health
Go
Service.
Cats.
And yes, thank you.
you.
Happy Friday. Dr. Aimee Ostick here with Health and Healing Direct Primary Care. Thanks so much. Have a wonderful weekend. Happy Father's Day.
Happy Father's Day.